everyone, and welcome. My name is Kate McKinney. I'm from the Next Door, and we periodically do these panel discussions for our supporters, for our staff, for anyone to learn a little bit more about the disease of addiction. And I'm thrilled with today's topic, addiction in the seasons of a woman's life. And I'm going to introduce to you our esteemed facilitator named April Band, my friend and coworker for the past couple of years. I'm going to send you bios on all of our great presenters today, but just know that you're getting a very seasoned counselor and woman of the Lord. So April, if you'll take it over and give some housekeeping and introduce everyone else.
Yeah, for sure. Thank you, Kate. So first and foremost, it looks like most people have their microphones muted. I would encourage you to do so because as we move through our time together today, we'll hear from several different people. We have 4 people on our panel today. And as they share, we want their voice to be the thing that we're hearing instead of background noise in other places. So make sure to keep yourself muted. Also, you may want to click on the speaker view for this time together so that when our panelists do respond and give answers, that it's them that you're seeing, so you're able to see who is sharing. Well, as we're together today, I have a list of questions that I will ask our panelists. Each of them will share. The panelists and myself will dialogue back and forth for a little bit. And then at the end of our time together today, we'll have some Q&A. So if you have questions that come up throughout our time together, jot them down. You can send them in the chat as well, and we'll make sure to get to those at the end of our conversation today. I would encourage you also to go ahead and put your name and your email address in the chat column on our Zoom call here. At the end of the call, we'll send this recording as well as resources and bios for all of the panelists. So you can put that in the chat. I think Kate mentioned it, but just so you know, this is being recorded. So our panelists today, I'm going to tell you their names, and then I'll give you a little bit of background on why we're talking about this today, and then we'll hear from our panelists. So we have Paris Brown with Axial Healthcare. We have Becca Humphrey with Strongwell 180 Health Partners. We have Dr. Lacrecia Dangerfield, CEO and founder of Re-Imprint Your Life Coaching and Counseling. And we have Dr. Michael Ferri with the Next Door. So this group of panelists is really awesome, and I can't wait to hear from them. However, before we do, let me give you just a little bit of background on our topic. So we're talking about the seasons of a woman's life. And this conversation is really, it's a springboarding off of a theory that psychologist Daniel Levinson talked about. And his theory is the seasons of life theory. So in this theory, he describes that people progress through seasons and that life events help them to progress through seasons. In his work, he points out that human beings are developing, that human development is universal. We are all doing it. All people are growing and changing. He also says that life events play a big part in the way that people develop, and that relationships play a big part in the way that people develop. So while Levinson's theory talks about men and women, today our focus is women. And our goal for this time together is that we're able to look at 4 different seasons or moments in a woman's life and talk about the issues and developmental things as is related to addiction. I would like to encourage us that we look through the lenses that Levinson suggests. And as we hear from our panelists, that we acknowledge that people are in process, that growth occurs continually all the way through our adult years, and that in each season, there are specific needs and specific developmental concerns. At the Next Door, you all know women are our specialty. We treat women. Just speaking of this year at the Next Door, we have served women ranging from ages 18 to 64. So as you can tell, really paying attention to the different seasons of a woman's life is really relevant to us. And we believe that it is for others as well. You can hear even in that age range that it's relevant for us to look at the unique needs of women. And also we know that treating women, women have unique needs when it comes to their treatment for addiction. And we know that when we pay attention to those unique needs of women, that they tend to do a little bit better. So let's hear from our panelists. Our first up is going to be Paris Brown. And like I said, we'll send you her full bio. But today with Paris, we're going to be talking about adolescence, or those pre-adulthood years. So really in this age range, we're talking about 10 to 22 or 24, somewhere in that range. So Paris, we know during this stage that adolescents are searching for a sense of self and personal identity. I'd like to hear, in your experience, what are the big stressors or developmental strides impacting women in this age group?
Yeah, for sure. I think I should preface by saying my experience in working with the adolescent population was a lot of uninsured or like TennCare clients. So that could kind of skew some of my opinions or thoughts on some of this stuff. I would say mostly what I saw, the main stressors were a lot of peer pressure. If their friends were using it, they wanted to fit in. I also saw like family stressors or family use being very prevalent. If parents use, the kids were more likely to use, along with socioeconomic stuff. One of the big things when I was thinking about this question that stood out to me was the number of teenage girls that I had that were influenced to use by dating older guys. And I just really thought that was super important to mention today, because I would say a good majority of them, their first use was by way of an older partner.
You know, I'm glad you pointed that out, Paris. In my experience around the next door, it's really common that relationships for women are connected to the onset of their addiction and their relapses.
Yeah, I think so. Even seeing like a 16-year-old date someone who's 19, it's just a different level of maturity. And there tends to be sometimes even an aspect of control that goes into it.
Mm-hmm. Yeah. In regards to this adolescent age bracket, what mental health concerns do you see for women of this age?
So I see a lot of I saw a lot of girls that struggled with things like depression, anxiety, trauma. And a lot of them, without realizing what they were doing, were using substances as a way of self-medicating. So, just a lot of education, explaining to them that sometimes it's tied together and there's a reason.
Mm-hmm. That co-occurring nature of mental health happening alongside of addiction.
Yeah. I had girls that would use super early, and use a very wide assortment of things. And a lot of it was because of wanting to numb themselves and not feel some of the things that they were feeling.
Mm-hmm. In your experience, Paris, at what age do you see adolescents starting to use substances?
I would say about 13. About 13, and it typically will begin with like marijuana or alcohol.
Okay.
That's typically what I saw.
Okay. What role, I know you mentioned that there were a variety of reasons like relationships and their mental health symptoms that they were treating on their own. What role do you think that social media plays in drug use for adolescents?
So much. Social media makes it more available. We had kids advertising what they had for sale on social media. So it makes it more available. It makes people think it's more cool, especially this age group. If they see their friends using it on social media or celebrities that they look up to on social media, it might make them at least lower their guard a little bit to be more interested in trying it possibly. And I will say, one of the most interesting things that I experienced while working with this population was having a kid tell me that one of their favorite musicians talked about using certain substances, so that made them want to try those substances.
That's a kind of peer pressure that is beyond what I would expect, that peer pressure of what they're seeing from their friends but also peer pressure from celebrities, essentially.
Right, right. And I mean, like, what kid, like age 15 maybe, said that they heard in a song, about certain things and got addicted to some really hard stuff because of that.
You mentioned a little bit ago that marijuana is pretty common. Are there other substances that are readily available to this age bracket?
Yeah, I mean, I would say marijuana, any type of pills, including opiates and benzos, was what I saw a lot of. And the social media, like I said, makes it easier to get, but a lot of my kids would say that they got access to it at school. That school was the easiest place for them to trade substances.
That's interesting. You kind of read my mind a little bit. I'm curious where they get their substances.
So some of them would take them from like grandparents or, people who they knew who were prescribed certain things. But other than that, I mean, it's lots of buying on the street. Some of the popular things as of recent had been things like Percocet, Xanax, and even the prescription cough medicine.
Mm.
I can't think of what it's called right now, but those were like the super popular things. And then right as I was leaving, I saw an increase in psychedelic use as well, and hallucinogen use.
Okay.
Yeah.
Could you speak to a little bit what some of the signs and symptoms would be that potentially an adolescent is moving in the direction of addiction?
Yeah, I would say if you see increased isolation, depression, maybe acting out behaviors at school or home,
Okay.
drops in grades or drops in attendance would be red flags. And I would also throw in like having an older boyfriend could possibly be a red flag, and hanging out with an older crowd could possibly be.
Okay, thank you. That's very helpful. I have a couple more questions for you. Let's look at brain development. So we know that so much is happening for adolescents. During this age range, so much is changing in their brain and their body. So in your experience and even in your education, what are you seeing as how do substances impact this? How does substances impact the development of their brain?
Yeah, I don't have a lot of experience in brain development stuff, but I can say I know that for this age group, their prefrontal cortexes aren't fully developed, and substance use can definitely impact that. So poor decision making, impulsive behaviors, things like that.
Yeah, thank you for that. And then also in your experience, what treatment centers around town focus on adolescents who are in addiction?
Yeah, there's not a lot of options for Nashville to be the it city that it is right now. There's not a lot of options, but there are intensive outpatient and outpatient options in Nashville, and that would be Stars Nashville, Meharry, Bradford. But as far as inpatient, the nearest would be Jackson, like right outside of Jackson, in Memphis, have treatment programs for substance abuse.
Okay. Wow, that's a huge area of need for our city.
For sure, for sure.
I appreciate that info. Paris, I'd love to get the names of those even outpatient providers that you mentioned to send to our people today. If you want to send it over to us, I'd appreciate that very much.
Definitely.
Thank you so much. So now we're going to switch over and hear from Becca. And like I mentioned, if you didn't hear me at the front end, put your Zoom on speaker view so that you get to see the panelists that's speaking when they're speaking. So Becca is with Strongwell 180 Health Partners. And so we're going to spend a little bit of time talking with Becca about a specific moment or event in women's lives that actually spans over several seasons. So we're going to talk with Becca about pregnancy, and ultimately, because of age-bearing years, this life event could occur in adolescence and early and even middle adulthood. But we're going to talk about those specific needs of women and how they are impacted by pregnancy. So, Becca, hello. Thank you for being with us.
Thanks for having me.
You're coming to us all the way from Knoxville, right?
I am, yes.
Fantastic. Okay, so I'd love to hear from you. What are some of the primary issues and stressors impacting pregnancy for women in addiction?
So definitely when you think physically, I mean, we think about just kind of the common things as far as morning sickness. You get, extreme like exhaustion, you're extra tired. You have weight gain, which then causes different types of pain in the body. So lower back pain, pelvic pain, things like that. And one thing that is hard with addiction is when we add any kind of pain to the body that we're not used to, that can make it even more difficult if you already are addicted to a certain substance. And because a lot of times that's how these women have gotten into addiction, is through some type of pain management or something like that. And then of course you just have your hormonal changes as well that creates you can create anxiety, depression, on top of the normal behavioral health diagnosis that they may already have. And then as far as just mental, this mental side aspects of it, we know now that postpartum depression actually shows up well into the pregnancy. Not, we still call it postpartum, but you can actually start showing symptoms before delivery. So those are things that we watch out for a lot of times. And then of course, with anxiety and depression, a lot of the medications that they were prescribed pre-pregnancy are not approved for pregnancy. And so then the doctors have to weigh risk over benefit and everything. So they may have to actually go off those medications during the pregnancy, which makes it a little more difficult.
Yeah, it does. You described that very well. And those are some unique concerns, especially in the way that physically and mentally, it's all intertwined together. One thing affects the next for sure.
Absolutely.
Can you speak a little bit to, let's say a woman is pregnant, she's also in her active addiction. What are some risk and or barriers of seeking help while pregnant and addicted?
Well, one of them is just the lack of resources and knowing where to go, because there's just not a lot of resources that really just verbalize, like, if you're pregnant, come to us. It's still hard to find. And I think that's really across the board, not just in pregnancy, but it is just difficult to find that. And then, of course, when you have the stigma around it, and then you have the legal issues and the concern about DCS, and things like that, it makes it difficult to actually go anywhere and admit that you are dealing with substance use disorder or that you're in active addiction, because then you're admitting to something that could inevitably take your child from you, with that admission. And so I think especially just not really knowing what resources or where to go. And then I also think that there are few OBGYNs that are willing to even treat patients that have addiction while pregnant. So even finding your first stop, because really that's it. I mean, to get into treatment, anything, you need OB care. And there are just so few OBs that will actually take pregnant women that are using substances. And normally it's a high risk OB. And so then it's, getting insurance and finding all of that and finding a doctor that will care for you.
Mm-hmm. Yeah, that's something that we understand at the Next Door, medically detoxing individuals, especially individuals who are pregnant. It's hard for those women to find the right place. Yeah. Can you speak at all to any of the risk involved with detoxing from substances while pregnant?
Yeah, absolutely. It's actually kind of like a multitude of risk, right? So one is just the physical risk that we think about depending on the substance. So if we're talking about opioids, you're going to have pretty severe withdrawal symptoms. You're going to risk getting dehydrated. You're going to have your normal body feelings, and those can be dangerous, because if you start getting dehydrated during pregnancy, that can actually cause contractions, which then ends up in preterm labor. So that can be really dangerous. And then, if you're talking about benzos or alcohol, it could just be deadly altogether for mom and baby, unfortunately, because that's the thing, is we're not just talking about one life, we're talking about two at that point. But then also on the side of recovery, to try to hunker down and detox on your own. It always seems like something reasonable until you actually do it. And I tell people, you can get through the worst of the withdrawals, but if you're not supported, you don't have the right supports in line, and you're not, actively seeking recovery support, your odds of staying sober and not, relapsing decrease phenomenally. And so if you don't have that support and the people there for the follow-up and the wraparound care, you're likely not going to stay on track, and relapse will probably happen.
Yeah, support is so essential. You kind of allude to it a little bit, and I'm curious if you could speak to it a little bit more. Why is it so challenging for a pregnant woman to stop using?
And I'll just, I'm a peer advocate for Strongwell. So I'm actually a mother in recovery myself. So a lot of what I speak on is from personal experience, but also with the women that I work with. So personally, with my second pregnancy, I was actually in active addiction myself. And there is so much guilt and shame as a mother, like you get pregnant and you think like, oh, this is such a great, time in my life, and I'm supposed to protect this child and do everything I can. But when we're talking about so many substances that are physically, you're physically dependent and mentally dependent on, it's really no longer about whether or not you care about your child, whether or not, you love that baby, because you absolutely do. But there's substance use disorder tied along to it. There's other behavioral health diagnoses, and just the stigma and shame of actually coming out and saying like, I'm carrying this life, but I'm also addicted to this, can be really difficult. And there's a lot of shame and guilt that goes along with it. And then physically, it is just difficult, because it's difficult to get off of drugs and alcohol in a normal situation, I guess you could say normal. But when you add all of the extra, like I said, like not feeling well, the exhaustion, just the ups and downs of your emotions and everything, there's so much tied into it that ends up being really difficult. And I think sometimes it's hard to verbalize that, because we don't know that's what we're even feeling when we're in the middle of it. We just know we're scared, and we feel really alone, and we feel judged.
Thank you for sharing that. It is so helpful to even hear from your experience, both professionally but also personally. I appreciate you giving us that picture of your experience. I'm curious, you've mentioned a couple of things that work. So let me just ask directly, like for a woman who is in active addiction, who is pregnant, what would work for her to get clean, to get help? Like what kind of treatment is necessary?
So I definitely think harm reduction is key. And so, I think for a long time we kind of treated addiction and pregnancy in one way. And it was like, how can we get mom off all substances, and that's the healthiest thing for baby, and reduce, NAS risk and everything like that. And we're learning that there are a lot of different options. So of course, MAT, medically assisted treatment, whether that be buprenorphine, methadone. And even though there are risks to mother and, baby at delivery and everything, they significantly are decreased if mother is on a steady dose throughout her pregnancy, and she is receiving, behavioral health care, and she's, actually working a recovery plan. So I think really setting her up to where she feels like she can succeed, and wrapping services around her. So one thing that I know there at the Next Door, and then even what we do with Strongwell, is we provide the behavioral health support, we provide peer support, we have nursing on staff, making sure that they're getting medical care, because oftentimes that is something we've neglected in our addiction. Going to the doctor, getting a yearly physical, that just seems really foreign to us in active addiction. So really teaching the importance of, going to your OB visits, making sure that you're attending, if you are on MAT, making sure that you're attending those visits, and maintaining just your prescription and taking it as prescribed, learning how to just do kind of these basic like healthcare things that seem basic until they're no longer basic. It's not something that we've either learned or that we've practiced for a really long time. And I also just think making sure that we eliminate the stigma around if you're, if MAT is something that you want to do, then we're going to support that. But also if tapering is something that you're going to do, that you want to do, we're going to support that as well. And what is the best option and what's the safest option, and make sure that all of the doctors, OB, providers, everybody is on the same page for that taper plan.
Mm-hmm. Yes, that's great. Let's say one of us has a friend who is pregnant and we're concerned that maybe there is an addiction happening. What are some signs and symptoms that we could look for?
So I definitely think, isolation is one of the first ones that comes to mind. Just, I think in pregnancy, a lot of times when we want our friends and family around and they're celebrating our pregnancy. And so if they're very isolated, and then not attending OB appointments, if they're not going to the doctor at all. Also just, there are signs, especially when it comes to heroin and things like that right now, and even pills. You can look for track marks, which I know is something that everybody knows what they look like, but on the hands, in the arms, things like that. If it's the summertime, looking at the feet, things like that, if they're wearing sandals. But then also not seeing weight gain during the pregnancy, or even weight loss oftentimes. And then just erratic behavior. Are they saying they're going to be somewhere and then they're not showing up? Are they not taking care of themselves physically? Are they not taking regular showers or baths? Do they, just kind of look not taken care of? And also one thing I say, and I think it was probably one of the biggest signs for me, which is very extreme emotions that were outside of the norm of pregnancy, because that's the thing, sometimes it's hard to weigh that, are they extra aggressive? Do they have a tendency of, making excuses for not showing up or something? But it can be difficult, because I will say, within pregnancy, it is a time in our life that we will absolutely fight to hide that we are addicted, because it is such a difficult time.
Thank you. Those are really helpful things to look for. The last question I have for you is, could you give us some recommendations on treatment options for a pregnant woman?
Yeah, absolutely. So, of course, the Next Door, we partner with you all a lot with any of the pregnant women that we work with for inpatient treatment. Also at Strongwell, we work with pregnant women throughout their pregnancy and then a year after baby is born. And we do provide therapy, peer support, and nursing support, which is we try to wrap around all services and make sure that we're checking all the boxes off to make sure that our moms are really cared for. And then just a few other ones, and I am in Knoxville, so I kind of know Knoxville area a little bit better, but I will get a list as well of kind of across the state. But we utilize Great Starts, and it's with the McNabb Center here in Knoxville. They do take pregnant women. It's a long-term treatment program, so they are there. They go during pregnancy. It's normally about a 13-month. If they go right after delivery, it's about a 9-month program. Mm-hmm. You also have Journey Pure, who does inpatient. They take pregnant women and they do IOP. Bradford Health, they do IOP as well, both here and in the Nashville area. And then some MAT, there's quite a few MAT providers now that do buprenorphine for pregnant women. And we utilize Health Connect, Revita, Westbrook oftentimes. And then I just wanted to really throw out there, if you have a pregnant woman who doesn't know where to go, the first places to call are any high-risk OB offices in your area. Because if and you can call a regular OB, but they're going to send you to high risk anyway. So that's really just the place to start. And then there are a few places like Oxford House and Renewal House that they're sober living houses, and they now actually accept pregnant women.
Thank you, Becca. Those are very helpful. If you guys have any questions that came to mind for Becca, feel free to put them there in the chat, and we'll come back around and ask those questions at the end. So now we're going to hear from Dr. Dangerfield, and we're going to focus on the season of a woman's life that is middle adulthood. So by this age, we're really looking at ages 40 to 60, in that range, 40 to 60, 40 to 65. So Dr. Dangerfield, I'd love to hear from you. What are some of the primary developmental issues and stressors impacting this season of a woman's life?
This season of a woman's life, the middle age, is like there's a lot of transitions that take place. Like one, that sometimes waking up to that rediscovery of who am I, because I've been mom, been wife, but then those life changes take place where children grow up no longer needing mom. So that finding herself, she becomes a caregiver sometimes for even having to take care of her kids or her parents or her in-laws. So those are some of the things that kind of happens to women. Even when you think about even single women, when they realize around, when they start getting around to the age of 40, they even thought they were going to be able to have kids by then. And then the realization that they may not get to have the children that they thought that they would be able to have. So then that kind of is a developmental stressor that comes on. It's like, what do I do now if I'm not able to have children? The career changes could take place. Maybe she was a stay-at-home mom for the time that her children were in school, and then having to go back out into the work world, and having to feel like she has to start over. And so those are some developmental changes, and just coming into her own space of who am I as I go into this, because maybe I'm looking towards retirement, or if I'm looking at the age of retirement, but maybe I cannot retire. What do I do because of a breakup of a long-term marriage, because of divorce, and having to look at those financial things that have to keep going to move forward the future? Because as we're seeing, women tend to be living longer in our society, so having to take care of themselves if maybe they didn't, because their spouse was taking care of them and had the financial resources, and now they're having to go through that transition of really developing that piece of life again.
Yeah, as you're saying that, Dr. Dangerfield, I'm thinking about even that phrase, midlife crisis, and how that falls in this age bracket. Between 40 and 60, there's so much change that does occur. Those practical things that you mentioned, and then even think about, you kind of talked about it too, physiologically, whether it be the end of those childbearing years and maybe even moving into menopause, as we're at the later part of this middle adulthood, so many changes occurring.
Yes, within the body and outside the body.
Let's talk about mental health a little bit. What are some of the mental health challenges that you would ascribe to this middle adulthood for women?
A lot of times, even in my practice of working with women that are facing middle age or are seeing more anxiety, depression, grief and loss. That's really a major player, which can play into the anxiety and the depression. But then also during that time, I've seen women, they really are addressing some of their childhood traumas. So that tends to show up. So we may say it's a post-traumatic stress disorder because of the complex traumas that have taken place, because that's when they decided things have gotten the way they want to talk about what has happened growing up from their genetics, not only their genetics, but their family of origin, things that have happened that have impacted them. And so when they're going, as I talked about a little bit, is that they're going through these phases of life, or these life transitions of trying to figure out who they are at this age in life. They start looking at what got me here. And so that can impact their mental health, and when they will begin to start taking care of themselves and their mental health.
Yeah, at the next door, we see a big correlation between those childhood traumas and their substance use
Mm-hmm.
and the co-occurring nature of the anxiety, depression, PTSD that goes along with the disease of addiction,
Yes.
Uh,
And you see and you begin to see also women with personality disorders, some of those things that kind of come along with what we see as some of those behaviors where individuals have that distress in their emotional regulation, and then they may be diagnosed at the in around that age with, even though it may have been an issue earlier, but it starts to come out more.
Yeah. Let's talk about addiction a little bit. What are some of the signs and symptoms of addiction for middle-aged women?
With middle-aged women, our tendency is the alcohol use. So what happens? The signs is that they're using more. So which means the isolation at home, because what comes along with substance use disorder are the just being having addiction is, for women it is a secret. The stigma that they don't want to be seen within the stigma, so they'll hide it. But then not showing up for work, it takes a toll in their work life. It takes a toll in their family life. It could be more erratic behavior and emotions because of not only the hormones from going through perimenopause or menopause, but just the hormonal effects of being a woman, of getting, trying to get your body back in order, but those emotional things that come along. So you see erratic emotions, like where it's like 1 minute, because I've heard family members say, 1 minute she's nice, she's going with the flow, but the next thing she know, it's like she's raging, and it's like, well, what happened? But it could be it's the use of, also the overuse of prescribed medication because of chronic pain. Because as we get older, we tend to have more pain in our bodies.
Mm-hmm.
And I've heard women describe even having fibromyalgia, where it's a constant pain, so they're taking a prescribed medication, but then it helps for a little bit, but then with the chronic pain they start using more, and then when the doctor stops prescribing, it goes to, well, what do I do now? So that'll bump it up to another form of substance.
Yes. I hear you saying that typical drugs of choice for this age bracket look like alcohol and prescription medications.
Yes.
Yeah. Let me ask you your thoughts on, I've noticed recently, especially during COVID, lots of funny banter, intended to be funny banter on the internet about wine o'clock, or things like, don't ask a woman who's drinking from a bottle how she's doing, from a wine bottle. Like, what do you think about that, Dr. Dangerfield? Do you think that normalization of drinking around the clock is problematic?
Yes, because it makes it easier for a woman to go from this occasional use, social use, to a more daily dependence. And as we know, when things are seen in our public social culture as being okay, people take the stigma away from it.
Mm-hmm.
They're like, oh, it's not bad because everyone's doing it. So it's almost like that with kids, it's peer pressure, but they're seeing peer pressure as a bad thing. But with adults, the same pressure. It's not, oh, that's not bad because my friends do it. And then the accessibility, when you can pick up alcohol in the grocery store, so you can put it on your grocery list, a case of wine or 2 or 3 bottles of wine, as along with your milk, your cheese, your butter. So it makes it easier to be seen as it's okay. And when social media says it's okay, we know people tend to say, oh, social media said it's okay.
Mm-hmm. Must be
I can
okay.
do it. Yeah, I can do it.
Yeah.
Yeah.
Yes. I appreciate your thoughts on that, and even reflecting on what you mentioned before about looking for those signs and symptoms, because you're right, it is pretty common right now, and peer pressure looks different for middle-aged women than it does for an adolescent, but there still are those external influences guiding that path. Could you speak a little bit to when does a glass or two of wine turn into a full-blown addiction?
Well, for each person, it's different.
Okay.
Because it could be that, you know, a glass or two for one person just has no effect. But then for another person, a glass or two a day can have a more increased dependence.
Okay.
So, but when you notice that you go from the social drinking to your body needing it, because I've heard women say, it's like, oh, at first I was just drinking a glass or two at dinner and I was okay. But then I got to where my body felt like I was craving it. That for me to get up the next morning to function, I had to start my day by having a glass of wine, or being able to put it into different containers to take along with them because of life stressors. And so it went from, I may have a glass or two over the weekend with my friends because we went out to happy hour or came over, to I need it every evening because life has gotten so stressful, especially during the pandemic, where people are not leaving home and mothers are becoming teachers at the same time, still trying to manage work, but they're needing something to cope.
Yeah. Yeah. We're talking about wine and alcohol here, but that same thing probably applies to pills and marijuana, even in this age bracket, looking for those external things to cope.
And with marijuana use, you know, there's so many different ways that, even though it's not legal here in Tennessee, there are other ways that it's being packaged, like the edibles, where individuals can get it more they have easier access to it.
Yeah. Yes, you're right. My last question for you is, most treatment facilities will take women in this age bracket. Can you speak at all to some important things to look for when someone's choosing a treatment for a middle-aged woman?
Yeah, most definitely one that deals with co-occurring situations, because usually when a person is coming in with a substance use disorder or substance use dependence, there are some mental health factors that come along. Being able to even look at the physical and the biological aspect for women, and then doing some inner child work, some processing about who am I as a woman? Because a lot of times they were like, oh, I never thought about these things that could impact my use or why it started. And then also some trauma work. Most definitely places that focus on doing trauma. And then also it could be some place, even though a lot of people, when they think about dialectical behavior therapy, they're thinking, oh, it's someone that may have borderline personality disorder or tendencies. But the modules and the core things for DBT really are very helpful in helping individuals learn those emotional regulation and that the stress tolerance and the mindfulness. So if a place has the skills groups and being able to offer those types of skills to their clients, their residents, then it helps in that journey of recovery.
Thank you, Dr. Dangerfield. Those are so helpful. Last but not least on our panel is Dr. Ferri. Dr. Ferri is with us at the next door. He is, from the looks of it, holding it down as the only male on our call today. So thank you, Dr. Ferri. Appreciate that. I see your name on there. Can you hear me okay?
Yeah, I'm just trying to get my video to turn back on.
Okay.
But I can hear you loud and clear.
Great. Well, do you mind if I go ahead and ask you a question?
Fire away.
Okay, so we're talking with Dr. Ferri about women in late adulthood. And so what we're referencing here is women who are 60 plus. And as I mentioned earlier to you guys on the call, we have seen women of this age bracket at the Next Door even this year. So Dr. Ferri, I'd love to hear from you. Could you describe the primary developmental issues and or stressors of women in late adulthood?
Yeah, so I've really been enjoying listening. Thank you so much for putting this together. This is such a good kind of refresher and reminder of what our goals are and what we're dealing with. I've worked with older adults in my private practice and in the hospital for years now, for more than 12 years at least in this capacity. And I have really relied in working with kind of aging adults on the kind of the Ericksonian developmental stages model. And I think a lot of people use that as kind of a jumping off point. But for aging, you know, as we come into our older years in this loose range, it could be 55 for someone who retires early, but it could be, you know, 70 for someone who has, anyway, it could be anywhere in that range. But where the older adult comes into this range of having to kind of wind things down from the middle years of productivity and producing and caring for, and then coming into this age of winding down and reflection on life. And that's kind of what Erikson proposes as the developmental task of aging. I think that works so well as a framework for helping understand ourselves and understand our patients, our family, as we're going through those years. So integrity versus despair, right, is his stage that he proposes. So the idea would be that as we wind down our work life, as we're becoming grandparents and really becoming, you know, even our grandchildren are growing up at that age, we're kind of working towards a new vision of ourselves, or integrating this vision of ourselves that is whole and integrates our failures and our regrets, as well as our triumphs and and overall kind of resulting in kind of a satisfaction in looking back on our life. Mm-hmm. And a lot of times that's so helpful to work with people who are struggling with depression, anxiety, who are coping with addiction, to help them through that developmental task can be really rewarding and helpful, because often there's a lot of tension between the kind of failures and regrets, you know, seeing a son who has not turned out the way we hoped, and, you know, or a daughter who still has, you know, who's been divorced and still is asking for money, and she's 35, and you know, when I was 35, I had my act together. All that kind of stories we hear. Those are real tensions and stresses that, with help, you know, a person can integrate that into their life, just like we integrate scars into our body, kind of. Mm-hmm. So stresses, you know, you ask about stresses in that time of life, they sound very similar to what Dr. Dangerfield was talking about too in the middle age, which is we're starting to deal at that age with more and more losses, and we kind of accrue them like barnacles on a ship as we get older. So the loss of a spouse, loss of parents, loss of independence, loss of bodily integrity. You know, my bladder doesn't work the way it used to work. My knees don't work the way they used to work. Loss of a feeling of purpose too. Like, you know, I was always taking care of my kids and then my grandkids, and at least I always had to go to work every morning. But now you know, how many times can I clean my house or walk my dog? Mm-hmm. All those things that are kind of stressors to navigate during the advancing years.
Yeah. What do you think are some signs and symptoms for addiction in this age group?
So it's very similar, I think, to what Paris was saying, but I think we all said it was isolation. And I think we all mean like kind of a sudden change. Like, you know, my teenager used to come down after supper. She would hang out in the kitchen and we'd chat a lot, and she'd babble on about this and that, but now she doesn't. And it's the same with mom. You know, mom used to call me every night after dad died, and now she's stopped. And when I do call her, her voice is a little slurred. Or other changes that we say, something's making red flags go up. Moodiness that wasn't there before, irritability, not being interested in the usual things that they were interested in before. Another thing is, you kind of have to have a spider sense about these things, and you can integrate all your red flags together, and you start seeing, bruising that wasn't there before, sleeping in when they never slept in. You start to put all these things together. Something's wrong, and it's amazing. Like, it's the same with dealing with your teenage son as it is with your elderly mother. That you're picking up on all these kind of signs and that could be depression. It could be they've got a new boyfriend. I could be, but it definitely could be addiction. And so, none of it proves there's an addiction, but all of it says, oh, we'd better dig deeper into what's going on here.
Yeah, absolutely. Just some things to pay attention to. Can you speak to what are some common drugs of choice for this age group?
Yeah, I was just thinking of giving an example because in my clinic yesterday afternoon, I met with a woman who was in her late 50s who kind of exemplified all of this. Her 3 daughters had kind of insisted that she come, and she was a little bit resentful about being there. But late 50s, she had just lost her husband a year ago. The year before that, her mother had died, and the year before that, her father had died. So she had 3 big losses. So she spent a year kind of grieving before her daughters convinced her to come live in Franklin, or somewhere near my clinic's in Franklin, somewhere around there. And so there, for the last 3 months, she's lost all her friends, lost her church community, lost her kind of sense of confidence in knowing what grocery store to go to, what the traffic would be like, all those things that we don't really think about. And she's almost 60, all these losses. She feels no sense of belonging where she is now. The daughter she's now living with just got divorced, so she's supporting her daughter in that, and the little grandkids, and she has had a history of drinking, kind of kind of heavily with parties and with her husband, who died unfortunately of alcoholism. And now, since he died, for the last year, she's been drinking more than a bottle of wine every night, and that's what she tells me. So usually I multiply by 2.5 or so, right? So she's at least drinking 4 to 6 drinks a night, and that's what the daughters are noticing. And the daughters called the office saying she's having slurred speech. When we call her, she doesn't answer. All those kind of things that we were just kind of going through. So it was very interesting and timely to see her yesterday after reflecting on all these things for this talk. So with that, I've forgotten, April, what your question was, which one we were talking about.
Sorry, my computer was giving me trouble for a second. I was just asking about some signs and symptoms of potential addiction. So you answered it, that she had all those great big losses and her family was noticing some things, and that I guess alcohol is what she was choosing to cope.
Right. Yeah, so alcohol is probably the biggest one because it's the most ubiquitous, like Dr. Dangerfield was saying. But we also see, I think it's super common to see in elderly women, and I think it's a little bit more in the South, more prevalent in the South, is benzodiazepines. A huge problem with benzos in the older population. I think that's a cultural thing, and we will see that kind of shift out gradually as this group, as a new generation ages into the elderly years. But it is certainly a really common thing for 60 and 70-year-old women to be coming to psychiatrist's office having been on a small dose of Valium or Xanax for 30 years. Not uncommon at all. And with the death of a spouse and some lack of accountability or the emergence of some depression, they begin to request more and more. And of course, they usually have a relationship with this doctor for years. It's being increased gradually, and before you know it, they're in the office with memory problems, moodiness, things like that family are wondering about. So Xanax, Valium, Klonopin, we metabolize slower as we age, most things. So the effects of alcohol and the effects of benzos are accentuated as we age. So it takes less to have more side effects the older we get. Opioids, of course, is another, because as the older we get, we got more pain. And it is really something in America that we have really easy access to opiates and in relatively high doses compared to other places. So again, the older we get, our livers don't metabolize as fast, so that we get toxicities much faster. And that's what we see a lot of too with chronic pain in the elderly. Then you see addiction to and dependence on opiates too.
Yeah. I want to ask you one more question, Dr. Ferri. On our call today, there are some of us who are clinicians and some of us who are caregivers and some of us who are just friends of people in this age group. So I'm curious about, like listening to you talk about sometimes women have been on these substances for years, or the alcohol is just gradually increasing as they're dealing with life stressors. Do you have any tips or recommendations on how to help a woman in this age bracket see that maybe it has moved from just pain management or just a glass of wine here or there to a problem? Like how do we increase their awareness that it's crossed over into the land of addiction?
Mm-hmm. Yeah, I think there's some really classic things that apply across the board, but it's probably easier for someone who's in her mid 60s or early 70s who's been taking Xanax for 20 years to not notice, versus a mom who was prescribed it during postpartum depression to figure out 6 months in that there's a problem. So, so often encouraging someone to ask the questions like, am I thinking about this medicine a lot? Like, do I think a lot about my glass of wine at the end of the day, which turns into a bottle of wine? Do I think about that throughout the day and can't wait to get there? That's a warning sign. Do I end up taking more of this than I usually do or than I'm prescribed? So if it's been a glass of wine a night for years, why is it now 3? Or if the doctor's prescription says 0.5 of Klonopin as needed once a day and I'm taking 3 of them a day or 4 of them a day, am I running out early? Am I asking friends or relatives for more, like searching around for more? I can't tell you the number of women that come through detox, either at Rolling Hills where I've worked or at the next door, who have found themselves on heroin. Women who would never ever imagine themselves using heroin, but they have run out of their pain pills enough times and run out of enough money that they've found, well, these nice little pressed pills that they'll sell you on the street cost less and they do more for me. So that's kind of unbelievable, but true. Doctor shopping, if getting angry at one doctor because he doesn't give me enough leads me to searching out other doctors. And another thing is, and this is kind of good to ask a family member, I think. I ask it of patients all the time, like, do you get angry when people ask you about your drinking, or and why? Because it's a great point to start reflection together on, like, if it's so innocent as you think it is, like, why are you getting upset about it? What do you have to be defensive about? And then that's kind of a motivational style too, and you kind of work with that. So those are some signs where we could ask ourselves, is this getting into addiction land and addiction behaviors rather than just appropriate use of something?
Thank you. Those are so helpful. I personally feel like we could talk about this later adulthood population all day long, because we have people in our lives that are, crossing into this age category. All of us do. But because of time, I'm going to say we probably shouldn't talk about it all day long. We all have things to get to. But thank you so much, Dr. Ferri, for sharing your insights on later adulthood. I didn't see any questions come through from anybody while we were chatting, but let me ask right now, does anyone have questions for Paris, for Becca, for Dr. Dangerfield, or for Dr. Ferri?
I actually have a question.
Yeah.
and I don't know who to address this to, but so much of, I work at the next door, but am not one of the frontline clinical folks, but I hear clients say a lot that I'm a third generation alcoholic, or I first used drugs with my mom, you know, so it's generational. And we also use the words about stopping the cycle of addiction. We haven't talked about the childhood age population, but if you are a person who has a substance abuse disorder and you don't want your kids to inherit that, at what age is it appropriate to talk to them about that? When can kids understand? I'm thinking about Paris, like with the adolescent group, like when is too young, or when is the right age to address that if you're worried about your kids carrying that on?
That's a hard question to answer. I would probably say maybe around like the age of 8 to 10, once they get a little bit of a more firm understanding of things. And I know like so many of the adults that I've worked with in addiction, they try to find ways to phrase it to make it kid friendly, you know, saying things like, well, mommy's really sick, or, you know, I've heard even kids or women say that they tell their kids that mommy has to have this special thing so she doesn't get sick. So I probably around the age of 8 to 10, I would say would be the best age for understanding, but I don't know. Anybody else have any thoughts?
I think the only thing that as far as being somebody in recovery with 3 daughters, and they all have, like, I have an 11, a 6, and a 5-year-old, is really not only about when is the right age to talk to them, but also watching for those behavioral health you know, tendencies that they may present at a younger age, because of course every child can be different, and really learning as a parent how to recognize certain behaviors, and then, you know, being able to get them into therapy at an early age, because I think for a long time we tried to do the whole like just ignore it and it'll go away type thinking as parents, you know, like, oh well, that's just how they are and they'll get better, or if we just act like everything's fine, you know. And we've realized that that has not worked. And so when we talk about stopping the generational cycle, it's really that early intervention with behavioral health, not so much the substance use, because, you know, in my opinion, and it is my opinion, that substance use is just a symptom. There's very few people that have substance use disorder that doesn't have a co-occurring disorder. So I think it's really recognizing at an early age certain symptoms that they may be presenting, and then learning how to parent that. But then also definitely making sure that it's age appropriate in what we're talking about. You know, my 11-year-old, she knows much more about my recovery than my 6-year-old, but they all know. I mean, like my youngest is 5, and I go to meetings on Zoom now that, you know, we have because of COVID, and she'll get on there and she'll be like, hi, I'm Penelope and I'm in recovery. And I'm like, okay, you're not in recovery, Penelope, but she just hears me say it so much. So I think sometimes, you know, we've tried to sweep it under the rug for so many years, and that's not working. So I think just having really open, honest conversations with our kids is what's going to change the trajectory of what we see as far as substance use and how we talk to our adolescents.
I will also say, my name is Elizabeth. I'm the family interventionist here at the Next Door, and I work with the children in the permanent housing community here in our Freedom Recovery community. And Timby Talks About Addiction is a wonderful tool. We actually had Trish Luna, the author of the book, she came and did a reading with the kids here, and we actually bought the kids a copy of the book. And it also comes with like a little lovey, like a little stuffy, their own little Timby. So the moms here in our Freedom Recovery community were also present for the reading. And you could just see the moms, you know, sitting in the back with, you know, gentle tears, because they were so grateful and so excited that now they had a tool that they can read with their kids, and, you know, they can read it again and again. So this was written by Trish and her sister, who is a licensed therapist. So great tool, fully recommend. Just wanted to jump on and raise awareness for this book because it's so great and it's been such a helpful tool.
Thank you, Elizabeth. I love that. Were there any other questions? Okay. Well, if you are on this call and you have ideas for panel discussions that you'd like to hear, if there's information you would like to know, please email us. You can email us at rsvp@thenextdoor.org. And then lastly, I just wanted to mention that the doors of the next door are always open. So if you know someone, a woman who is in need of treatment, please send her our way. If you yourself are in need of support, we would love to meet you, love to talk to you, love to see how we can help you. You or anyone can contact us at 1-855-TND-HOPE to get access to treatment. So thank you guys so much for being here today. Thank you to our panelists. Please make sure your name and your email are in the chat column so we can get you the bio and contact information for our panelists and a list of resources. Thank you.
Thanks.
Thank you all.